Hi, welcome to Roots Review. We're going to go over many different variations of nerve flossing today. Nerve flossing is a fantastic exercise to integrate in for warm-ups. I think the average person could use a little bit of nerve flossing. Today we're going to focus on the lower body in this video, and we'll, in another video, explore some upper body nerve flosses to balance out the rest of the system. Nerve flossing is usually only given to people with some sort of a burning, numbness, tingling pain in the leg, but there's a lot of very subtle nerve symptoms that we can get throughout the back, hips, body, thighs, knees, feet, arches, toes that can be nerve related. And I find that it's very often misdiagnosed or underdiagnosed. We're waiting until people have severe pains to call them nerve pains, but slight aching, cramping, irritation of an area, something that feels like a little bit duller rather than bright and sensitive, can also be a nerve sensation, and I would like to help us explore that today. Nerve flossing can really look like whatever you want it to be. In a nerve floss, what we're pretty much doing is taking the nerve to its limit of movement, of length, and then we're softening off of the back of it. Similarly to how we use a muscle stretch, or stretch for a muscle, to release the fiber tension, a nerve likes flossing. Nerves do not like stretching, and so within the variations that we're going to do for the nerves, we're going to make sure that the intensity always softens off of that initiation of the point of tension, rather than in a muscle stretch, we would find that initiation of the point of tension and deepen into it. So very different categories. It's important to help your brain separate the purpose between the movement so that you're not catching yourself actually irritating the nerve and keeping it sensitive versus helping it to calm down and helping yourself to progress. We're going to go over a couple of the most common nerve flosses first. The first one's going to be done laying down on our back. This one I often give people who are trying to integrate something in the morning or night before bed, where they're already laying down, because it's just kind of inconvenient to get on the floor during your day. In this position, we've got the leg relaxed in our arms. The closer it is into our chest, actually the harder the movement gets, and the more we're using our biceps and arms in a way we don't need to. So really just let it hang there. Some people might not even have this hip range, and we could use a strap or something else to just give us a little bit more space to get the leg further away from us. This area of the movement isn't going to change at all. We're only going to change the knee down. We're going to come up towards the ceiling and soften away. There are variations, which we'll do in a second, that involve the foot also being part of a nerve floss. But what's important is that we touch the ceiling of this sensation of pulling or tension. It might be in the front of the shin, it might be in the back, it might be in the back of the thigh, but we're not holding it or staying there, and we're not squeezing through it. We're just touching it, saying hello, and softening back off. Usually, to keep things simple, I just start people with this variation, and we'll do 10 or so on each side. I haven't counted, if we're being honest, so I'm going to switch myself over. And as we come up and down here, we're just looking for a sense of change. We're not really looking to make a big difference in the intensity of the symptom. We're just really looking for a sensation of softness or release that comes through the area that the nerve flows through. It might feel like warmth or heat. It might feel bright, or people tell me all different types of things about how the sensation changes, but I would say warmth or heat is probably the most common one, almost as there's this rush of blood flow that goes down the legs. From here, like we said, we could add a different variation on where we involve the foot. So that can look two different ways. One, we can involve the foot as we come up, where my toes come towards my nose. As my leg comes up, this is an advancement. This is a little bit more intense. A little bit less intense is to point as I come up and soften with my heel towards the bed, the mat, the floor as I come down. And the third option is to go up to that point of tension and just pump a little gas pedal here. Now, as we're picking nerve flosses, something that's going to come up throughout this video many times is that these variations are not 100% equal. The first variation, where we're really bringing our leg up and down, is going to help us most open a restriction in the nerve that's higher up in the leg, that's either in the hamstring or in the kind of calf distribution area. This last one, where we're really pumping this gas pedal at the ankle, as you might be able to imagine, is going to help us release a little bit more tension lower down towards the lower shin and foot, rather than as much at the back of the hamstring. The whole nerve is connected, so they're all really working on the nerve tension, but we can also be specific and play around with different points of movement, whether they're at the hip, knee, or foot. Because this nerve travels all the way from our lower back around the leg and out to the foot, there's just a lot of different hinges where we could create that softness, as we talked about in the beginning of the video. This sciatic nerve floss involves no spine movement, so it's really nice for anybody who's got either a spine diagnosis or some sensitivity in their lower back or neck or anywhere else that just being supported feels easier on the area. However, we're going to take things into standing versions, sitting versions, and other ways we can integrate it into our day. Nerve flosses are best done at volume. High frequency, low intensity is the phrase that we use often. It's almost like we're just settling the nerve back down. Oop, just a little bit less, a little bit less, a little bit less. If we try to push through the nerve tension and really just like do 100 reps in a row and I'm going to get better, not as efficient for this type of system, and we do run the risk of irritating it. A muscle that we're loading in strength training, we might add on the extra load and push through the extra reps, but for nerve exercises, really light and sprinkled through the day as often as you can across a bunch of different variations. This next one's going to be done in sitting. Maybe this could be used at a desk. Think that the common thread throughout all these that we're going to do is that there's a long line down the back of the leg, the calf, and the foot. This is the longest that line could possibly go. That line actually matches our nerve. For any of these nerve flosses, it requires that we get to that point of tension and soften off of it. Some people might feel tension here just by pulling their foot up. I require a little bit of a hinge to get into my, okay, that's quite a bit more intense here. And I often get the note people say, oh, but I'm just stretching my hamstring. One note to check if you're actually feeling your hamstring here, and now I'm going to start flossing while we stay so that I'm not stressing out my nerve. For the hamstring, the sensation would never pass the knee, and it wouldn't be mediated or controlled by the foot position. So to check whether or not something is a hamstring sensation, we can pop our foot out like this. We can hinge ourselves forward and say, okay, I feel the stretch now. If I relax my foot, does that stretch go away? If the answer is yes, or if it goes down, then it was probably your nerve. If it feels exactly the same, no matter if your toes are towards your nose or your toes are towards the wall in front of you, then it's probably your hamstring, and then you can deepen into that position, like we said, for the muscle. But if you're feeling anything in your calf or foot, or it feels more intense when your toes are up towards you, then we're going to be looking at the nerve. The first variation that I did was pulsing back and forth at the knee. This is similar to where we were laying down, saying we can move from different joints, different hinges to create that softness, but my spine and my back are not changing in this variation. The next one that we could do is, again, find that point of tension. You may notice that it gets deeper and further away from you. After doing these 2 sets of nerve flossing, my nerve has already softened a little bit, and I can come a little bit further forward to do my calf ankle pulse variation. Nerves should respond in the moment to the exercises that we're doing. And a huge asterisk I'll throw in here is I don't have any nerve pain, but I've got a little nerve tension, and that's pretty normal being in a body. So these are great for everybody. They really help to take us up to the next level as far as really making sure that things feel free and fluid throughout whatever area of the body we're working on. Another option from sitting, this one is super common. You'll see it across lots of YouTube videos and more like traditional physical therapy exercises, is the seated sciatic nerve floss. When it's demonstrated at its full intensity, which it usually is because nerve flosses and demonstration videos are usually done by people who have no pain, the movement is too intense or strong for someone who does have nerve symptoms. There is no circumstance where you should be doing the full range of a nerve movement if you already have nerve symptoms at rest, ever. So you always want to make sure that you're finding that kind of Goldilocks spot for yourself, and if it looks way smaller than what we're demonstrating here on any of these positions, so be it. That's you honoring where your body's at and making sure you're getting the appropriate intensity of the exercise. For this seated sciatic nerve floss, what you normally see is a head and leg moving together, toes and nose at the same time. So as my foot comes up and knee straightens, my head heads up to the ceiling. This has an effect of slackening our nervous system, where it exits off our brain in a ponytail called our brainstem and travels down our backs to just give it a little bit more slack at the top so we have a little bit more room at the bottom. By doing this, we're really making sure that we are flossing the nerve back and forth. If we go toes and nose together, this then becomes a nerve tensioner as we're taking the full structure of the nervous system into the longest and most stretched or pulled position that it possibly can go in. If you feel nothing when you do this, okay, well then number one, you probably don't need to do it because you're not getting a nerve floss out of it, but that's safe. If you come even halfway into this position and you're already feeling a pull in your leg, there's not really a reason where we want to add an extra tension from curving this upper body portion, and the slackening can help a lot. This is not my favorite nerve floss at all. And it's because there's not as much control in the position. There's a lot of moving parts. My knee's moving, my foot's moving. I don't have any back support. My head's moving in some variations. And so I really do like for the sitting option to do either the knee pulses or the foot pulses. And these can be integrated into just sitting at your desk. If you happen to be like, okay, well, I'm on a meeting and I can't really hinge forward, but maybe I could do them while I'm sitting and listening, something as easy as popping your leg up is a great option because this brings the nerve into a deeper form of like length, a deeper position of length, the same way we looked at with the other one, but it's rested and supported and we can really just focus on moving one area. So by doing this one, maybe I can be a little bit more relaxed and involved with working or something else I need to do, but also pop out a quick rep or set to just take the nerve tension down throughout my day. Again, helping to make things feel a little bit more accessible, looking at standing variations is also a great option. And we can choose which of these exercises we do across all the positions to also match when we have our symptoms. If you always feel like, oh, when I go grab something from the floor, I feel this big pull down the back of my legs, so we'll want to do a forward fold variation to our nerve floss as well to be specific to the situation and position. Nerve flossing is better than none, but why not make it specific when we can? So if you tend to feel a lot of nerve symptoms when you're sitting in Uber or something like that, driving, then maybe the seated variations will help you make a little bit of extra progress. But don't be dissuaded if you find like the sitting one feels like nothing to me, but then when I go to do this forward fold one, it feels like I'm getting a lot out of it. We're gonna take this kind of like hamstring stretch position up to a standing version. It's the exact same thing, but instead of my hips being sat on the bench, we're just gonna hinge and pop our bodies forward. When we say hinge, we're really talking about moving from this hip crease where my leggings are bending, not by leaning forward from our back. So we look at it a little bit more from the side. My hips go back, but my spine has stayed in the same position. It's a small movement. This will help us get into a more controlled nerve tension versus this. I've got a lot of mobility just leaning forwards. I could do this all day and pop my head to my shin. However, if I go to my spot where I get my nerve tension, it's a very slight movement if I'm really controlled about it. And this helps me be more efficient and get more of what I need out of the movement. So again, we can do our knee pulse. We're not gonna do knee and foot at the same time, just to keep it simple. So I'm doing my knee pulse now. I'm already feeling my tension in this left leg, which I haven't yet done as many reps on. Soften, and then I'm gonna switch over to try my calf pulse. I consistently feel that the knee pulse gives me a lot more relief and space as a feeling rather than the ankle pulse, but demonstrating all of them and then see what works and feels good for you. Taking things into the next option, we're gonna do a forward fold. Now, forward folds also bring us into a really intense nerve position. And so we're gonna show you first a way to soften that since now our feet are gonna be planted. And the way we're gonna soften that is by pointing our toes a little bit, which is gonna be elevating our heels. The higher we elevate our heels, the more space we're creating for the nerve at the foot and ankle. So you can play around with different heights, but especially if we're just kind of inching into it, a little bit of a heel raise as simple as either a towel, or I could also use a small plate if I was in the gym, popping my heels up on top of it and coming over into my forward fold. Either way, the heel elevation helps us out. Asterisk, pause. If you ever see or hear someone tell you that while deadlifting, you can get a better quality of movement, a better load, a better isolation into your hamstrings by elevating your toes, the opposite, please know they don't know what they're talking about, and you should run very far away from the rest of their advice. When you come into this toe elevated position by any metric, we're actually adding length to not the hamstring, but the sciatic nerve, or the peripheral branches, the segments that branch off of the sciatic nerve as they come down the calf and foot. That is not what we're trying to hit when we hit a deadlift. So also this tip helps us for deadlifting. If we put our heels elevated, we soften the likelihood that we're going to encounter a nerve tension when we're trying to hit our hamstrings. And so never deadlift with your toes elevated. Consider warming up with a nerve floss, and consider elevating your heels when you deadlift to help the focus really reach your hamstrings. As we come into this position, I like to start with somewhere that we can put our hands so that we have a little bit of support underneath them rather than just kind of a dead hang, but we can work towards that. Just kind of a walk the dog, just pulsing both knees back and forth. Of course, we could do just one, but we're here and both legs are under the tension, so why not move through it? And as I come through these pulses, again, I'm not holding any of that tension. I'm not getting a good stretch back here. We're just walking through it, walking through it, walking through it. I may switch my stool out for something a little bit deeper that takes me into a further bend. From the theories we used before, if I wanted to make this feel lighter, I could elevate my heels. I could not straighten so much from my legs. I could lift my head to slacken some of the nerve. I could lift my arms to come less deep into the position, all the way until we can take either a full hand to the mat or forward fold nerve floss. There is no reason to ever attain that for the purpose of this movement. Just demonstrating different variations and depths to the nerve floss movement. As our final progression, we could step off of our heel elevation, flat onto the mat, and any variation of the mix, hands with support, hands without support, head hanging, head lifted, which is going to be softer, head hanging, which is going to be a bit more intense, and just pulsing and flossing through it. Again, I don't have any nerve pain, but that feels really nice on my body to create a little bit of space, and I'm getting that rush of warmth feeling heading down the back of my legs. Consider picking any of the variations you saw, trying them out, and if you want to find one or two that you're like, that really feels like the thing that I'm benefiting from, either once or twice a day if they feel quite tight, or just to warm up for activity or movement when you're doing any of your other warm-ups is a great place to start.